Hi, I'm Dr. Cindy Haynes of Health Day TV. Making news this week: a potentially dangerous drug interaction, a special threat to women with diabetes, and yet another reason why kids need plenty of sleep. First up, certain antibiotics, known as the macrolides, are commonly used to fight off infections, and a family of drugs called calcium channel blockers are often prescribed for high blood pressure. What happens when these drugs cross paths? In a new study, Canadian researchers found that people who were using calcium channel blockers and took the antibiotics erythromycin or clarithromycin were at substantially higher risk of being hospitalized for low blood pressure. For people who are on a calcium channel blocker and need a macrolide antibiotic, an option called azithromycin may be a better choice. Next up, a story on what happens when diseases cross paths. In a new study, researchers from Johns Hopkins University compiled 8 earlier studies to look at the outcome of breast cancer in women with diabetes. They found that people with diabetes who developed breast cancer were nearly 50% more likely to die than breast cancer patients without diabetes. They also found evidence that those with diabetes had a tendency to be diagnosed with cancer at a more advanced stage. And finally, people aren't sleeping as much these days, including children. Researchers have already found that kids who get less sleep may have a higher likelihood of being overweight. A new study in the journal Pediatrics took a closer look. The researchers found that obese children tended to get less sleep, and kids who slept less or slept very different amounts from night to night tended to have levels of insulin or bad LDL cholesterol that raised red flags. As a result, kids who get plenty of sleep on a regular schedule may be less likely to become obese. I'm Dr. Cindy Haynes of Health Day TV with the news that doctors are reading, health news that matters to you.